Hello, my name is Maryna Hura. I'm a dispensing optician and a lecturer at Bradford College. I am particularly interested in sign language, BSL, in the deaf community and their culture. So this is my specialism, my passion. However, I'm not proficient in BSL. I am currently working towards a level 3 qualification. So, having worked in an opticians for a while and having experienced certain situations where I felt quite hopeless and helpless with deaf patients, I decided to enroll onto a course and I acquired a BSL level 1 qualification by 2019, and by March 2020 I had my level 2 certificate. Currently I'm working my way through a level 3 BSL online course. So what I would like to do first is I would like to give a little bit of a background, a little bit of information around deaf awareness, some stats, and then I'll introduce you to some useful science. So in the field of deaf studies, the use of uppercase letter D in the word deaf means membership of a deaf community, and the use of sign language as a primary or preferred language. If we use the lowercase letter d in the word deaf, it means that we're talking about patients or people who have medically determined hearing loss, but they may not consider themselves a member of the deaf community and they may not use sign language. There are many varieties, and there can actually be more than one sign language in a single country. For example, there are two languages in Belgium, French and Flemish sign languages. In Spain, there's Spanish and Catalan. Also, there are different sign languages in countries, for example, those that have the same spoken language. So in the US, UK, and Ireland, the sign languages are quite different. Don't think, please, for a second that sign language can be learned quickly. Sign languages are highly developed languages and they have their own grammar, syntax, and just like with every other spoken language, there are sentences that are difficult to translate. There are certain words or signs that don't have literal translation. So there are a lot of aspects to that. It is estimated that in the UK, there are approximately 87,000 BSL users who are deaf, but we're talking more 150,000 BSL users that include children and translators and the interpreters, so children of deaf parents. Deaf community has a very rich and vibrant culture, and they have their own traditions, their own humor, and their own custom. So these are just some statistics from the WHO website. And as eye care professionals, we need to consider eye conditions which may lead to visual impairment and or permanent vision loss. And think about how many deaf patients may not be aware of the critical signs or symptoms to look out for just because they may not have access to the relevant information. When we think about the deaf community as a whole, they consider their deafness as a natural characteristic and they often reject the notion of being disabled. However, in the UK, as we know, under the Equality Act 2010, disability, including deafness, is one of the 9 protected characteristics. Therefore, eye care professionals, so optometrists, dispensing opticians, contact lens opticians, ophthalmologists, must be aware of the legal aspects and local protocols, such as their duty to provide reasonable adjustments for their deaf patients. We need to consider ways of making our working environment deaf friendly, whether you work in high street practice or in a community setting or in a hospital. Optical professionals should think of ways to raise eye health awareness within the deaf community. We clearly have National Eye Health Week. However, some of the information may not be easily accessible for deaf customers, patients. In order to raise this awareness within the deaf community, we need to think of ways of liaising with the local deaf centres, perhaps BSL interpreters, create visual resources, utilize social media more. In practice or in a hospital setting, if we are not able to book an interpreter for whatever reason, just think of simple things, simple steps like be open, be friendly, allow for longer appointments, use imagery, so use a lot of visual resources. Always ask for permission to use written communication. it's only polite to ask because some deaf people don't necessarily have the right level of education and they might struggle with written English. Speak slowly and use simple words, as simple as possible, because of course some people rely on lip reading. Most importantly, be patient. So what are the reasonable adjustments? Well, sometimes it's not very clear what we class as a reasonable adjustment. So in order to bridge that gap, NHS England have created a document called Accessible Information Standard. And these are the three key aspects of why this came to light. So clearly deaf people have to have the same level of access to information about their health and eye health as the rest of the society do. We need to ensure that the deaf people receive the communication support that they want, that is the best for them, whether it's a BSL interpreter or speech-to-text reporting system. And also information has to be provided in accessible format. So for example, test results could be sent by SMS or emails in simple, easy to read English. This is some of the things we could consider as health professionals. So first thing I would say, aim at completing a deaf awareness course, and there are plenty of them available online. Learn how to fingerspell and possibly learn some basic signs, and this is what we'll do in the second half of this presentation. Learning sign language can be time consuming and sometimes it can be costly. So perhaps it's not for everyone. And some optical practitioners might think that it's not practical to learn sign language because they might not see that many deaf patients in their individual practices. But what I would say is aim at assess who you work with in practice and at least give it a go. If it's not for you, perhaps one of your colleagues would be willing to do that. And especially working as a part of a multidisciplinary team, definitely have the scope to find at least one or two people who might be passionate about it in a smaller team. Fingerspelling is useful, but it cannot replace the actual signs. Usually we only fingerspell things like names, places, or words that don't have established signs. Also, we need to keep in mind that with some of the medical terminology, including optical eye care, there are no signs for certain terms. For example, there is no sign for retina. So to explain to a deaf patient what retina actually means, you'd have to show them the image of the retina and in a roundabout way describe what it is. For example, it's a light sensitive layer at the back of the eyeball or something along those lines. Now I'm going to stop sharing the screen and I will have a go at demonstrating some useful signs. But first is I am going to show you the alphabet. So all the vowels are on our fingers of our hand. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, Z. Fingerspelling cards can be found on the internet easily, so you can Google it quite easily, and a lot of the deaf-led charities have them on their website too. So next, let's have a look at some question signs. Who, when, what, which, how old, where, how many, how, why. Next, let's have a look at some greeting signs. Welcome, day or good day, good morning, good afternoon, good night, bye, hi, the same, thank you, and please, sorry, no thank you. and repeat, or again, same sign. Next, let's have a look at some sort of common signs that could be used in an educational setting or in work. Sign, finger spelling, lip reading or lip pattern, eye contact, watch me, begin, finish, time, what, or what time it is. Some numbers I'll only do to 10 because we don't have enough time to go through all the numbers. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10. Numbers vary from region to region, but these are the common ones you could use. Then days of the week: Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, weekend. And then you could say, if you need a timeline, you could say a week, next week, or last week. So say if you're booking appointments or arranging something with your patient. A couple on emotions. So happy, sad, nervous, shocked or shocked, interested or excited, like, dislike, confident. Reception is the same as welcome, reception. Glasses, exam or examination, pay, voucher, interpreter. I, birth. So if you're asking for the date of birth, is birth number or birth date. So the order of the words is slightly different. Then some explanation signs. So clear, flashes, family, or sometimes family, good, show, help or help me, help you, bad, read, health, want, sunglasses. So if you want to ask how someone is feeling, you can ask them, how are you? Are you good? Are you healthy? Next, a little bit, few more emotions: worry, understand, or don't understand. Book, as in book an appointment. Medication, drive, can, or can't, cannot. Hospital, history. Health and healthy is the same, so healthy. Vision or visual. Problem or difficult. Important. Letter or word, same sign, letter, word. Don't. New, old, come. GP, so your finger spell GP, GP. Name, better, worse, work, equipment or technology, the same technology. Optician. So say if you wanted to ask your patient what their name is, you would say your name, what, and usually they will fingerspell their name. And then if you want to reciprocate, you would say name, mine, and you would fingerspell your name. So for instance, I would say name, mine, Maryna Hura. Thank you very much. I hope this has been useful, and good luck signing BSL.